I remember getting a phone call from the hospitalist saying that we have this patient who has really high blood pressure, hasn't been taking care of himself really, has had a lot of family stresses and such, and I'm a little bit worried about what the ultrasound's going to show. And he asked me to review the ultrasound, and I did, and it was clearly very abnormal, and I just said, I need to see this guy.
When I first got to Piedmont, they took me down for echocardiogram, and they found out that my heart wasn't pumping as strong as it should be.
We did a heart catheterization to determine why his heart was weak, and we found severe multivessel heart disease.
When they did the heart catheterization, they found out that I had 90% blockage in my heart.
If someone can be bypassed in this type of instance, we do send them for bypass. And in fact, I talked to the Piedmont heart surgeon who reviewed the films and felt that it wouldn't be the right thing to do for this patient because of where the bypasses were going to be placed and just the diffuseness of his heart disease. So I went and talked to Johnny about that.
At that point, I was ready to give up. I didn't care. I just wanted life to be over with.
And I said, look, I think I can still take care of you. I can still make you better, but I need your help to take care of yourself as well. And so I said, if you come to clinic and you take the medicines I give you, I think you'll do fine. But you gotta promise to take everything I ask you to take and try as hard as you can to do the lifestyle adjustments that I ask you to do and come to the clinic when I tell you to. And I think if you do your part, we'll be fine.
We have offered to our patients who have complex heart failure a chance to not just meet with a regular heart failure physician, which is both Dr. Kobylivker and I, but also at the same time meet with a pharmacist, meet with a nutritionist, our extraordinary nurse practitioner, and also have the input of palliative care, behavioral health in the same one visit when they come in for a single copay.
We've developed this clinic in response to the need of taking care of the entire patient and dealing with multiple facets of the disease process. The patient sees us all together as their advocate, and I think that's really important. We've just noticed a dramatic difference for the patients and their understanding of the disease process, of their ability to do well and stay out of the hospital and live as much a normal life as they can.
It gave me hope to live again. When you're sick, and somebody tell you that you need surgery, and then somebody tell you they can't do the surgery, and then somebody come in and tell you you can live, but it's gonna have to be some changes, so you have to adjust.
I always think that with the right medicines, at the right doses and the right infrastructure of a medical system, we can do so much for patients and turn their lives around. And so I'm always going to give people hope. He's really done everything we've said. His medical problems have completely become controlled. And I always have a smile on my face when I see him because I know where he was. And I know without changing what he was doing, he probably wouldn't be here. I think this is why we practice medicine. This is why we do cardiology. So we really can change people's lives.